We'll get started in just a bit. We're waiting for more people to log on. And Kurashai. Good afternoon, Tatsalaf. I'm Dr. Hartwig from Nimipu Health. I'm the medical director, and I'm going to be speaking today about the Janssen, Johnson & Johnson COVID-19 vaccine. We have received a small allocation from the Indian Health Service and would like to provide some education before we begin offering this. This vaccine will be available next week, and if it's something that you're interested in, please contact the clinic to get scheduled. The Janssen COVID-19 vaccine received EUA approval, which is Emergency Use Authorization, on February 27th, 2021. This vaccine differs a little bit from the Moderna mRNA vaccine that we have been providing. It is a viral vector, which means that the carrier of the vaccination is an inactivated adenovirus, and adenovirus is a common cold virus that also causes pink eye. It's been inactivated, so the adenovirus doesn't multiply in your body, but it serves as a carrier to deliver the information needed for your body to mount the immune response to COVID-19. So it will not cause pink eye, it will not cause a cold. It is a single-dose vaccination, so you get just one dose of the vaccine. It doesn't contain any eggs, preservatives, or latex, similar to the other vaccines. The safety data has received approval for people ages 18 and older. It may be provided in patients, as can the other vaccines, in patients with immunocompromised condition, autoimmune conditions, history of Guillain-Barré or Bell's palsy, or dermal filler use. Pregnancy data is also recommended. That data analysis is ongoing. There are some differences between the Moderna and the Janssen vaccine. First is that the Moderna is a 2-dose vaccine. The Janssen vaccine is a single-dose vaccination. The efficacy is also something that was different. So the efficacy is how effective the vaccine is, at preventing symptomatic COVID-19 infection. So the safety data for the Moderna shows that it's 94.1% effective at preventing symptomatic COVID-19 vaccines 2 weeks after the second dose, and the Janssen, Johnson & Johnson single-dose vaccine is 66.3% effective 14 days after the single dose. Side effects are very similar to the Moderna vaccine. You get localized reaction, and those can occur up to 7 days after the vaccine has been received, and approximately 50% of the vaccine recipients developed some sort of local reaction, so 1 out of 2 people. Localized pain, redness, and swelling at or near the injection site was common. There were also systemic reactions, again within that 7-day period, in approximately 55% of vaccinated recipients. And those systemic symptoms include headache, fatigue, myalgias. The symptoms generally resolved after 1 to 2 days, very similar to the Moderna vaccine. There were some other noted adverse events to the Janssen vaccine, which include urticaria, which is diffuse hives and itching. There were 5 out of the 3,300 vaccine recipients, And then tinnitus, which is ringing of your ears. 6 out of the 3,300 recipients developed that. There was also a noted thrombotic event, which is a blood clot formation, 15 out of the 3,300. But many of the participants who developed the blood clots, those 15 people, they had predisposing conditions, and there wasn't sufficient data to determine if the vaccine actually caused those clots, but they were that was a noted side effect that was mentioned in the safety material. There aren't any head-to-head trials. A head-to-head trial means that you take the Moderna vaccine and you compare it directly to the Janssen vaccine, or the Moderna comparing it to the Pfizer. There haven't been any direct comparison efficacy studies, so that makes it challenging for us to say this one's better than the other. Really, any vaccination that you receive provides protection and benefit for our community. All of the authorized COVID-19 vaccines demonstrate efficacy rates ranging from 65% to 95%, and that's against symptomatic lab-confirmed COVID-19 infections. All of the authorized COVID-19 vaccines demonstrated high efficacy, greater than 89% against COVID-19 severe enough to require hospitalization. In the vaccine trials, no participants who in any of the vaccine trials, the Pfizer, Moderna, or the Janssen data, nobody has died from receiving a COVID-19 vaccine. A delayed or local injection site reaction after any of the vaccines, the mRNA vaccines or the Janssen, or the Pfizer vaccine is not a contraindication to receiving a second dose. When you receive a localized response with pain, redness, or swelling, your body is mounting an immune response, an inflammatory response to that vaccination, and that's how your body is supposed to respond once the vaccine is administered. So because you have that local response, it doesn't mean that you shouldn't get the second one. It means that your body is functioning as it should, because there isn't anything in any of the viruses that will cause an infection in your body. So it's not making you sick, as we would term it. It's your immune system responding to that vaccine that was administered. There's a recent CDC recommendation that a person who is fully vaccinated, that is 2 weeks after receiving vaccination, we think that it takes about 2 weeks, well, the safety data shows us actually, that it takes about 2 weeks for your immune system to mount that immune response. And so people who are fully vaccinated have received 2 doses of the Moderna vaccine or have received a Janssen vaccine, and it has been at least 2 weeks since that last date of receipt. If you are among other people who are also vaccinated beyond that 2 week time span, it's not necessary that you mask in the presence of the company when anybody is fully vaccinated. Secondly, any fully vaccinated person is no longer required to quarantine following an exposure to someone with known COVID or to be tested. So if you have been around somebody who tested positive for COVID, but you've been fully vaccinated, you don't need to quarantine or be tested. You can certainly contact us if you have question or concern, but it's not recommended from the CDC that you get tested. And that recommendation is for you if you're asymptomatic. There are some variants and some repeat infections. We have not had or seen any in our community, but there are, last I looked on the Idaho website, day before yesterday, there were 16 total variant infections in the state of Idaho. They've done 326 viral sequencing of people who have been infected a second time. The Moderna vaccine is about 6-fold less effective against the South African strain of the variant, but it boded very well against all of the other strains. The Janssen data didn't have a lot of information about the variants that I'm recalling at this time. But the vaccination, the Moderna vaccine, has a poly response. It responds to several different areas of the S protein, not a single area. So it does still foster some protection against those variants. Moderna is currently investigating, and they're in phase 2 trials of a booster dose for the Moderna vaccine, specifically against that South African strain. Both of the vaccines that we have are only for people 18 years and older. The Pfizer vaccination, which is what the North Central Public Health District has an indication for administration in patients 16 years and older. There are some studies also going on with Moderna to look at the safety profile for administration in children 12 and older. There were a couple of other questions just on the posting for the website about the efficacy of the Janssen vaccine. So one of there was a Indian Country Today article that was linked that cited that the Janssen vaccine was only about 50% effective for natives. So the Janssen data cited American Indian Alaska Native population was 8.5% of the 43,783 patients who were involved in that study, but only 175 of that percentage, and I believe that percentage was almost 4,000. Only 175. I'm sorry, it was 3721. Only 175 of that 3721, 8.5% of people were from the United States. That low number of participants may lead to a lower efficacy. So the numbers aren't high enough for us to confidently say that the Janssen vaccine is only 50% effective in American Indians and Alaska Natives. It's not as effective as the Moderna vaccine, but it's still more effective than the flu vaccine. Another question was posed about hydroxychloroquine and ivermectin. There actually was a release today from Dr. Johnston, who is an infectious disease specialist at University of Washington School of Medicine, where they looked at 231 cases of COVID-19 from March to August, where half of the patients received hydroxychloroquine and the other half received placebo, and there wasn't absolutely any change in symptom resolution. And so that was consistent with the other randomized controlled trials that hydroxychloroquine is not an effective treatment against COVID-19. On March 4th, 2011, there was a randomized controlled trial that included 476 people who received a 5-day treatment course of ivermectin versus placebo. And again, there was no change in symptom duration or increased recovery from ivermectin utilization. There was another comment about vitamins and whether that was protective. The only one that has truly proven or most suggestive, it's not really proven, but most suggestive to be beneficial would be vitamin D supplementation. We have a lot of vitamin D deficiency really all over our country, but in our community as well. And it would be beneficial for for vitamin D to be supplemented. Again, there's not a lot of data to support that it truly proves benefit, but it certainly can in some studies. So I would recommend that if you're vitamin D deficient, that you go take advantage of some of the sun, especially that's out today. That would be great. The skin absorbs the sunshine or the UV rays, and then your kidneys generate the vitamin D that is protective for our bones. So please enjoy that. There are just some other myths that I'd like to go over. This resource is from the Mayo Clinic. The pneumonia and flu vaccines are effective against the COVID-19 vaccine. That's not true. The flu shot won't protect you against the COVID-19 vaccine. However, annual flu vaccines are recommended for everyone 6 months and older. Saline nasal wash was also something that was mentioned as being beneficial for protection against COVID, and there isn't any evidence that lavaging or rinsing your nose is protective. Higher temperatures, I know there was a discussion in our community earlier about sweat, if that was protective. Exposures to the sun or higher temperatures greater than 77 degrees Fahrenheit, it doesn't prevent the COVID-19 vaccine or cure COVID-19 vaccine if you're infected. Your body temperature is regulated very tightly by your own physiology. Lower temperatures, cold weather, and snow won't kill the COVID-19 virus. Antibiotics kill bacteria, not viruses. But some people, hospitalized people, are put on antibiotics in case there's a superimposed or an additional bacterial infection to the COVID-19 infection. So those are used only in serious cases. Alcohol and chlorine spray on your body won't kill the virus. Drinking alcohol won't protect you. There's no evidence that garlic protects you. A UV light or disinfection lamp won't be protective. 5G mobile networks, I hadn't heard about that, probably because we don't have one out here, but they're avoiding exposure to 5G networks doesn't prevent infection with coronavirus. Viruses can't travel on radio waves or mobile networks. Disinfectants on your skin. Disinfectants can kill germs on inanimate objects and surfaces, but they may be harmful to your body, so that's not recommended. Supplements, vitamin C, zinc, green tea, echinacea, N-acetylcysteine. There hasn't been any definitive studies to show that these are beneficial. Vitamin C, in fact, hasn't been proven to help a common cold. Could you take extra to try to boost your immune system? I was reviewing information preparing for today, and there was a doc, I think from Harvard, who mentioned we don't want our immune systems to be overactive or underactive. We want them to be balanced. When somebody has an immune system that's overactive, that may be a condition like rheumatoid arthritis or lupus or Sjogren's, where the immune system isn't functioning normally. When it's underactive with something like cancer treatment drug, that also makes us vulnerable. We want our immune systems to be balanced, and sleep is significantly beneficial. Hydration, a good diet, exercise, all of those things are going to help our body function as well as it can. Kara, are there any questions that we need to address? All right. Well, thank you for your time today, and hopefully we can hear from you if you haven't had or received the COVID-19 vaccine. We do have supply available at Ninipu Health, and look forward to serving you and helping you get vaccinated. Have a good afternoon.